1 year ago this week, President Trump signed an executive order signaling his intention for the U.S. to leave the World Health Organization. Today marks the withdrawal date outlined in that order, but the split is complicated. There are two requirements for countries to leave the organization. The first is giving 1 year's advance notice, which President Trump did. The other is a little trickier, a requirement for the leaving country to pay all of the dues it owes the WHO. The U.S. currently owes at least $260 million for 2024 through 2025. And in a statement to Reuters today, a State Department spokesperson said U.S. officials have no intention of paying those. The WHO, who has yet to officially acknowledge the U.S. is leaving and insists that member states will have to determine the country's status with the organization going forward. Dr. Judd Walson joins me now. He's an infectious disease physician and epidemiologist who works to improve child survival, growth, and development in low and middle income settings. Doctor, thank you for being with us. Would a U.S. withdrawal from the World Health Organization be unprecedented, and what would the effect be for global disease monitoring?
Yeah, thank you so much for having me. No, this is not unprecedented. So after World War II, both the United Nations and the World Health Organization were established, and those harbored in an era of unprecedented peace around the world and allowed us to, through these multilateral organizations such as the WHO, really help control the spread of disease and help countries to prioritize and address health concerns all around the world. In 1949, shortly after they were established, the USSR at the time and several other Eastern Bloc countries left and withdrew from the WHO. And at that time, the US actually took a step forward and became a very dominant force within the organization, which remained until last year when we signaled our withdrawal. And as part of those efforts, we were able to be at the table for a lot of very important discussions about prioritizing health around the world. Those countries, USSR and other countries, reinitiated their involvement with the WHO 7 years after they left. And since that time, there certainly have been many, many other ups and downs with our relationship as the US with WHO, at times where our contributions have gone up and down and there's been disagreements, but this withdrawal for the U.S. is unprecedented, and I think it really is something new and concerning for all of us.
Which areas of the WHO would be specifically impacted?
All areas of the WHO will be impacted. So part of that is because of the financial commitments. The United States was a major contributor to the World Health Organization, and as the WHO has tried to address this, two important phenomena have happened. One is they've had to downsize considerably, meaning that there are less resources available to support countries around the world with technical assistance. There's less resources for data monitoring for potential threats such as pandemics, emerging disease threats. There's less resources for helping to support supply chains. All of those direct impacts of the financial consequences of our withdrawal are real. And there are many other impacts as well that we will see. As countries no longer have access to support their health systems, we are starting to see them disintegrate. That coupled with some of the other harms that have been incurred because of the collapse of USAID and other foreign aid are having lasting and real impacts right now. I'm currently speaking to you from Kenya, and across Africa, we are seeing those impacts in very real terms right now. There's an estimated over 750,000 excess deaths that will occur this year because of these changes, most of those in children.
Well, Dr. Judd Walson, we appreciate you joining us on an important topic, particularly at this late hour where you are. Thank you.